Good morning and welcome. Welcome to this session at the European Health Forum Gastein. It is a pleasure. Thank you so much for joining us this early morning at 7:30 in the morning. Thank you to our online friends, our online participants. You will be able to ask your questions using Slido. And we are here to continue a discussion which already started yesterday afternoon. There was a session on affordability, I would say on the overall theme of affordability, organized by WHO Europe and the Oslo Medicines Initiative. We continue this morning with a very straightforward theme. How can we make medicines more affordable? This is a topic which is at the top of the European agenda. And we continue also this morning at 5 o'clock with another session which is going to touch upon the issue of affordability organized by the European Social Insurance Platform and MSD. I'm Yannis Natsis, speaking of EASIP. I'm the director of the European Social Insurance Platform. Thank you very much to Affordable Medicines Europe for coming to Gastein. If I'm not mistaken, it is the first time you're organizing a session here. So welcome to EHFG. It is a pleasure to have you. And this is a very important discussion, and it's happening while at the European Commission, we are waiting to see the proposals, fundamental proposals on very important pieces of legislation, including, and who would have thought a few years back, the general pharma revision. The way we approve medicines in Europe, the marketing authorization system. I don't think it can get more fundamental and more important than this. Also, including on the orphan and pediatrics, the medicines for rare diseases and for children. Very important pieces of legislation. And at the same time, of course, we talked about it already yesterday during the plenary, and this is, I think, a theme for this year's European Health Forum Gastein. We are in a state, Europe is in a state of a perma-crisis. We're going through one crisis to another, successive crises, very important crises that really shake and test social cohesion and social justice in Europe. I'll stop here to introduce our panelists. It is a pleasure. First of all, I'll start with our Danish friend online, Madame Dorte Berg-Wizard. She's the Deputy Permanent Secretary of State with the Danish Ministry of Health. Dorte, thank you so much for being with us. I know you did your best to make it to the Valley, but unfortunately Lufthansa let us down. If I'm not mistaken, it was Lufthansa. But thank you so much for it. It's a privilege to have you online. Ancela Santos, senior and one of the most experienced, I would say, lobbyists and advocates in Brussels in the field of pharmaceuticals for the European Consumer Organization, BEUC. It's a pleasure also to have a second member state perspective with Mr. Rui Portugal from the Deputy Director General from the Portuguese Ministry of Health. And of course, our host, Casper Ernest, from Secretary General from Affordable Medicines Europe. I'll go also to Sarah so that she can also tell us how we can make this session even more interactive. And of course, keep in mind, I always want my sessions to be interactive, so I'll come to you when you're done eating and enjoying your breakfast. But Sarah first, for our friends online, please.
Thanks, Yannis. So, friends online, you can go on Slido and there is a Q&A part, so please post your comments and questions, but also for the people in the room, you can scan the code here and go on slido.com, #Stella.
Thank you, Sarah. Sarah is a young Gasteiner, so it's a pleasure to have you, and thank you so much. Make sure you gather those questions and we bring them in the discussion. Dorte, if I may, I'll start with you. I gave a bit of an overview, a political overview of where we are right now with the political debate around access to medicines, affordability, the supply chain resilience, and many other topics. Which are the key priorities, in your opinion, from the Danish perspective?
Well, thank you very much, Yannis, and also from my side, I really regret not being able to be there in Gastein with you. I can hear the clinking of coffee cups, and I wish I could be joining you for breakfast, but thank God we at least have these online opportunities. And thank you also for your introduction, Yannis, and you're quite right. From our perspective in Denmark, we also look into seeing the situation now as some sort of perma-crisis for the EU. We're looking into a perfect storm now where our demographics are changing. We're having a very fast growing aging population, more chronic ill, and a really much more pressure on our healthcare resources, both in terms of costs and in terms of hands. So for us, that leads to sort of two conclusions. One is that it's important that we continue to improve innovation in the EU in terms of how we develop medication and making sure that we have the best possible treatment options available for our citizens. So we must ensure that we continue to have an innovative system, and any revision of the healthcare legislation and the pharmaceutical legislation should take into account that we continue to be innovative. We should also continue to have economic resilience in the EU, meaning that we should make sure that the changes we make do not impact our global competitiveness in a negative way. But saying this, it has to be balanced up against the gaps that the European Commission has rightly pointed to in the impact assessment, that there is not enough access to new medicines in the EU, not enough availability, and that there are also issues relating to unmet medical needs, as well as to the environmental impact and footprint of the medicines that we give our citizens. So there are issues that we have to deal with, and we think the Commission has put the spotlight on the right problems. But when you look at the solutions you come up with, we think that it's really important that you strike the right balance and make sure that you do not take away the current incentives for innovative medication, while at the same time you really must try and improve competitiveness. So I guess what we say is that a strong EU can make a difference and plays an important role in the case of affordability. We think that the EU should really contribute to creating a competitive market which can provide the affordable pharmaceuticals. And how do you create a better market? Well, in our view, it relates primarily to transparency. Transparency is important. And we think that increased transparency could provide the opportunity to make decisions on a more informed basis. This could both be in terms of information and data sharing practices between member states, for instance, on the market launch, but it could also be relating to price information. Of course, we need to keep in mind that there's a national context and there are also confidential price agreements, but it would be possible to share more information on prices at the aggregated level, for instance, on flat rebates or on links of agreements. And we also think it would be possible to promote more transparency on other issues relating to price. So in conclusion, the EU can and should do more to strike the right balance. We need to ensure access to medicines across the whole of EU, but we should not undermine the innovative industry that we also have in Europe that are very important for developing the new medication that we want access to.
Thank you, Dorte. If I may, does Denmark have an issue with high prices or excessive prices for some products?
I think all countries have problems with high prices, and in Denmark we very highly value also the input from the parallel imported medicines and also generic medicines that we get in. In fact, in the primary sector, it accounts for more than 50% of the medicines we use, but only spend about 8% of our budget. So there's definitely a case to be made for parallel imported medicines and increasing competitiveness between the patent companies, the innovator companies, and the generic medicine producers. So definitely we have a problem with prices of medicines, but when you look at it, in Denmark we have found some sort of balance. We have in the primary sector some of the lowest medicine prices in Europe.
Thank you very much. Very clear, and already you put out on the agenda a lot of different themes. I'll go to Rui. I'll go a bit to southern in Europe. Let's hear from you. I remember the Portuguese presidency, it's not such a long time ago, made the issue of affordability, accessibility, and availability a key priority. Where are we today?
Thank you very much for inviting me to... I'm very much a public health person, so not a pharmaceutical one, so I'll give you some insights on a public health perspective, I hope. Yes, that was a major issue we did, and actually at the very end we were very lucky to have an agreement on health technology assessment at the European level. This is one of the tools we can use for sharing information, like we were just discussing at this point, as well as to have a more transparent perspective into the consumers and all the citizens in Europe on the way how we build up the prices and the reimbursements of those prices with this health technology assessment. However, let me tell you one or two other things. When we talk about medicines and we talk about Europe, of course, the innovation initiative, it's a very good one. We need that a lot. This is a way also to have access on a universal coverage perspective in for European citizens and for our own citizens. But there is always, in a public health perspective, this dilemma, this dialogue of the common good into the individual good. And this is a very, very important issue when you'll be looking, and we don't discuss it so well, on things on human rights and access to medicines and the other value, or the other services, I would say health services and others. And then when we try to prioritize this and putting all the resources at the common perspective and the common good. When we have crises like this on COVID, this is a very, very important issue. Which one are you going to be favored? The common people, everybody, the population itself, or one or another individual? And the question is that now, as in every other country, I'm sure, there are, of course, for instance, rare diseases and other issues, a tremendous pressure to have access for medicines that can cost €1 million for one single patient. And then in a country like ours, this is really it is a very big problem. How those things are done. You always have a patient, a baby, that goes with their parents to a newspaper. They put the highlights first, front page. Next day, politicians are very much pressed, and they push to buy those medicines, and they did it. And then when you'll talk about having €1 million for something good as, cancer screening or something like that, we'll have struggling with that like hell, I would say, to get $1 million extra. This is also an issue that we have to discuss. It's a societal problem. Let me just put another thing. When I talk about medicines, we also have to talk not just at European level, but a global one. And if you look at the way the market is in a global perspective, United States has a very and tremendous role in here. So we are not going to resolve this, I would say, in a European level if we don't have dialogues with the Americans. So I strongly push that people don't think just on the European perspective, but more in a global one, for two reasons. One, because they really have the market, because the condition of the health system, it's very easy to have innovation and putting into the market that innovation. And the American society is very keen on this issue. On the other hand, and this is one thing, on the other hand is that we as Europeans, we have values of sharing at a humanitarian level. And you also have to think about this. It's not just for the Europeans, but for everybody in the world. And so, as I was saying, I'm a public health person, so this is a very global perspective. And that's the first thing I'd like to say now for the discussion.
Thank you. Thank you very much, Rui. And it's good that you remind us, first of all, there is a global dimension. Indeed, the European Commission, when looking at possible legislative changes, they're also checking what's happening outside Europe and taking into account the competitiveness. And Dorte already referred to competitiveness, but I really appreciate also the fact that you referred to the solidarity base, which is something that we need to defend and protect in Europe. I'll come to Acela Santos now. BEUC has been very active over the years in advocating for a lot of different things when it comes to pharmaceuticals in Europe and has been a protagonist in the debate around access and affordability. Looking now at the current opportunities, what is your wish list
It's long.
It's long, yes. We'll cut it in parts.
Yeah, we'll cut it in parts. No, first of all, many thanks also for the invitation and to speak on this important topic. And I will just take a bit of a step back. So from the consumer perspective, obviously medicines are essential goods and affordability is key to ensure access. No? Yet, as echoing what you said in the last years, and very much, I would say in the last especially 10 years, we've seen we've had increasing concerns about the prices of new medicines, especially for certain diseases, but it goes beyond that, because they're very high, and this creates challenges for reimbursement, for patient access, it drives inequalities, and it raises questions, right, about, so why are these prices so high? What drives that? Are we overpaying as a society? And is there room for bringing these prices down and still allow the drug developer to recoup investment, which is also something very legitimate? And from our perspective, the answer is yes. We believe there are good reasons to think that we are overpaying and that there's room to bring these prices down, and governments must do so to ensure fairness in pricing from a societal perspective and affordability, affordable access to goods that, as I said, are essential, also to meet the human right to health. And I think that's important to remember. We're talking about human rights here. So it's good to remember to put the right framework. Huh? So at the EU level, there is policy momentum to bring changes that improve affordability, starting with the revision of the general pharma legislation, which on the one hand brings an opportunity to also revisit the whole incentive system on data market protection and include safeguards. We would like to have safeguards in the system to avoid misuses and abuses. And the same could apply to the orphan regulation, I think. But also these revisions of the legislation bring opportunities to remove barriers to timely access to generics and biosimilars, no? For example, by expanding the Bolar exemption. And in addition to these legislative revisions, there is momentum also, and I echo what other speakers have said, to deepen cooperation amongst member states on HTA. I mean, the HTA regulation is, I think, something very good, a very good initiative, but also on pricing reimbursement. And this is necessary to ensure fairness in pricing, because it requires more transparency on medicine prices, but also on R&D costs. There's an interesting initiative in the pharma legislation about developing guidelines to establishing methods for defining R&D costs. I think that is very interesting, because we think that in pricing negotiations, this is information that the governments must have. So there's an asymmetry of information, how much you spent on this, on developing this product. Was there a public contribution? Did you benefit it also from subsidies, grants, etc.? And also there is, I think, momentum to expand joint procurement. We would like to see a joint procurement agreement that goes beyond crisis situation, because obviously joint procurement also increases the bargaining power of governments and the chances to secure a good deal for society, for patients and consumers. Another tool that I think at the EU level we have to ensure also medicines affordability is Horizon Europe. I mean, Horizon Europe, it's a tool to support the development of medicines. That's good, but it should go beyond that. We should attach conditions also to this funding to ensure that at the end of the day, the product is also available and affordable. And if we think about now the debate about how we incentivize the development of novel antibiotics, we should look at that, alternative models of innovation. So pull mechanisms like innovation inducement prizes with conditions to ensure then access, and we believe that this is a much better solution than the proposal that FP is making on transferable exclusivity vouchers. We have huge concerns about that, and I would be happy to talk about it during the Q&A. Thank you.
Yes, thank you, Ansela. And it is indeed a bit surprising, well, understandable, but still surprising that the European Commission came out with this or is considering transferable exclusivity vouchers, or when every single stakeholder in Brussels, with the exception of Big Pharma, is against it. But we will come back to this issue. Casper, is parallel trade a part of the problem or of the solution? What would you say?
I think it's very clearly a part of the solution. Of course, I have to say that, even if it's early in the morning. But I think where I would like to start is probably from the practical side of the market. I mean, we're out there every day. We are actually moving things across borders. We actually know what are the prices in the different countries. So I tend to have an idea that we are a bit more on the practical side. And that's basically what I would like to bring into this debate, because we have a lot of theoretical discussions. Yesterday in the Oslo Medicines Initiative, we discuss again a big global pricing model, equity-based tier pricing, and everyone has to be on board, and then everyone does the same thing, and everyone walks in the same way, and then, you know, perfection will be achieved. And we have heard it before, and it's actually not what's going on out in real life. It's not that lower income countries have lower prices. It's not that higher income countries necessarily have higher prices. It's not the reality. So there's a lot of discussion on which I call theoretical, but it's very far detached from what we just see every day out there in practice. So one of the things we see is that, for example, more innovative procurement models, and again, that's not all about joint procurement in one big pool or having ever more pressure on prices. If we look to Denmark, and actually to many people's surprise, as Dorte said, in the primary sector, they actually have the lowest prices in Europe. That's because they have a 14-day tendering model, if you ask me. So every 14 days, there's full competition. The one who wins the tender, the price is public. And so you can go in and find price data publicly available, the actual price throughout the history of this system. And that fosters an incredibly competitive environment for the primary sector in Denmark, which, by the way, then also for parallel import. So it's not because Denmark has the highest prices. On the contrary, Denmark has the lowest prices in the primary sector, and yet we sit on 30% of that market. And we don't get the medicines from Romania or Bulgaria. For Denmark, more than 20% of the imports actually come from Germany. And so why is that? That's because also in Germany you have flexibility. So you have free pricing the first year, and then after 1 year you actually go and look at what is really the value of this medicine, and the price goes down. So what we see in practice is actually where health systems go in and analyze what's really our situation, what's best for us, and they adapt their system, and they're flexible, and they don't sit and look at theory and big global models. That's where we actually see things moving, and that's probably what we want to move towards. And that comes also from transparency. The Danish system, for example, very transparent, also on the price. So that's one thing we would be calling for, which is not yet in the scope of the Commission's thoughts. But price transparency is very important. We have to close some of the information asymmetry that we have between the payers and the sellers. And then, I believe that we can have competition. So I'm probably a bit more in the corner of, actually, I do believe that, yes, it's essential goods, and yes, we need some form of fairness in this. But we can't forget that we have learned through history that the best way of actually creating benefit for consumers is probably through some form of market competition. So there's a bit of a balance. So that would be my first
Yes,
remark.
absolutely. Thank you. And it's very concrete or operational. Of course, there are some opposing views when it comes to what you just said, but it is indeed a useful reality check. Rui, and then I'll go to Dort, and then also to the people in the room, and Sarah, you will tell us if we have any questions online. But Rui, you mentioned the importance of collaboration and of exchanging of information. But what happened with the Valletta initiative and the initiative of that regional initiative of grouping the countries together and trying to work together and exchange information? What is the latest state of play? Is there hope, or is it dead?
We hope there is hope. Of course, you know, there's an initiative of several of the European countries to try to have a better collaboration of sharing information and even having joint procurement for certain type of drugs. As you can understand, they're not all the member states of the European Union agreed in the way that they were setting up the scene there at the Valletta initiative, and there are some, some problems in that. However, there are small things that are happening, like procurement, like these models that you're just talking, which probably it's a starting point, and maybe we get something extra. But let me add something about pricing. The experience of our own country. And you might remember, not to the young Gasteiners probably, but those others with the crisis on the 2011, 2014. Portugal was intervened by the Troika, as he said, the European Bank and the Commission and so on, like Greece, a little bit Italy and Spain as well. And one of the most important policies on the health was cutting the prices of medicines. And there was an initiative cutting of the prices. There was no negotiation, was an order to do that. One thing was cutting the salaries of everybody. And another thing was, for instance, myself, I got a 30% lower salary in 1 year, just like that. Was very, very strong. And another thing was pricing the medicines. And there is a risk here. And let me show you. When you talk about prices, it really needs to be a very fair competition as well. Otherwise, it doesn't work. And this was a not so fair competition, was that cutting the prices just like that. And we have a monopoly in Portugal. You know, 80% of the market is national health service. So that's it. And what happened is that the players, the pharmaceutical companies, were dropping out of the country and not supplying medicines. This is a tremendous risk, and you have to be very, very careful. And we experienced that. I remember that some of the options were to put, for instance, for those without intellectual property rights, trying to have the military laboratories to start making the medicines and things like that. So let me just have this into discussion, because I think it complements what you have just said on the fairness and transparency.
Yes, thank you, Rui. And it's important to remember that sometimes we often talk about the market failures, but oftentimes there are also public policy failures. For instance, in this case, where we have a distortion of competition that results in companies even leaving the market for some more acceptable reasons than in the case, for instance, of Bluebird. Dorte, if I may come to you, what about, give us a bit of a snapshot when it comes to the regional collaboration up there in the Nordics. Are there any interesting developments that we've seen in recent years?
I think in the Nordic countries, we try very much to promote the agenda of transparency. So we share information on how we arrive at discounts and transparent and fair pricing. We also share a lot of information on real-world data, so that we are able to better assess the side effects of the medications after marketing authorization, which I think is going to be very important in the future. Also to find new ways to repurpose the medication that have already been developed. It's very important to have this information. So there is a lot of fertile ground for the collaboration in the Nordics. But I see no reason why we can't expand this to the whole European Union. I think we can do more as a collective in the EU to improve access to medications. But I do also think that it's important to bear in mind what Rui said about this being a global field. We cannot just look within the EU and find solutions in an isolated room. We have to consider what is the impact on the companies. Will they withdraw from our markets? Will they relocate to the US and to Japan, for instance, and other markets where they might find easier access and more incentives for innovation? That would be detrimental both to our wish for making sure that we have innovative medicines available for our citizens, but also really be a huge problem for our economic development in the EU as such. Because we should remember that the pharmaceutical industry actually delivers quite a lot of GDP growth in many countries in the EU, and overall to our economic growth. So really we must be mindful that we do not prevent the development of innovative medication in the future, while at the same time making sure that through transparency, good market practices, more collaboration between all the member states in this field and sharing information, we improve access.
Dorte, can I ask you, you mentioned that there is a possibility, a risk of companies moving away from Europe. Are companies telling you that? Do you buy it? Are they bluffing? What do you think? Tell us the truth.
Well, I don't know. I can certainly say that many companies are concerned. I think the European Commission impact assessment has been made publicly available, and many companies have read it, and they are concerned. Whether they are so concerned that they might in the end leave the EU, I won't be the judge of that. But certainly there's a lot of concern that we should take seriously when we craft these policies. And we should really consider whether the objectives that the Commission have rightly laid out, that we fully agree with, whether they are best met with the trade-offs suggested in the impact assessment.
Thank you, Dorte. And Rui, on this, I want to hear your perspective too. Do you buy these threats, or is this a real
I'm
threat?
not in the field directly, but I have some doubts. And the reason is that you have a market of 400 million inhabitants with economical power to buying the products. You don't have so many strong markets in the world. And that's one thing. Another one is that even, for instance, if the pricing, and I'm going back to the Americans again, because a lot of the innovation and new medicines are coming from the United States. Look at the vaccines now and things like that. And so when they come to the global market, they really are looking, that's my perspective. I'm not an health economist or anything like that, okay? But they will be looking at that as a marginal profit thing. So they will be selling all around the world, even making a very small profit for each one of the selling. It's a lot. And they got the money they need for the reimbursement of the investment in their own country, because prices there are very, very, very high. And that the first technology, generation of technology is being sold out there easily. And so I have my doubts, because they can make a lot of profit still with a lot of competition and discussion on that. The question is that we have to balance. I agree with Dort. She's making the point there. You have to be fair. You know, you have really to be fair, transparent and fair.
Let's see if we can make everyone happy. That's my question. Casper, briefly, because Sarah, do we have questions online? Yes, we do. Okay, Casper, over to you, and then I also want to hear from Ancela.
Yeah, just a remark. I mean, a little bit provocative, but if that
Please.
argument was to hold, everyone would already only be producing in the US or researching in the US. Yeah?
Yeah.
Let's be honest. So I have the unfortunate situation of being the same nationality as Dorte, even if I haven't lived there for a very long time. But you know, most of our big ones are in any case foundations which cannot just move out, which has a different kind of focus, or should have a different kind of focus. So I don't buy entirely into it. But on the other hand, I'm not completely, it's not a question of, for example, anti-industry. I fully buy into the logic, for example, when you have very big public procurements of 2 years for the whole country, if you don't win that tender, you withdraw from the market. You don't have a sales force sitting there for 2 years waiting until maybe next time you win. Again, that's why it's not to promote the Danish system, but that's why a 14-day tendering model, it actually keeps competition in the market instead of getting it out of the market. And that's what I mean with, again, go to the practical side. I fully understand it. We have cooperation with some pharma companies in smaller countries like the Baltics, because we do have a sales force there, because we sell a large number of products, and so we can actually use our sales force on their behalf, and so you have licensing agreements and other things. There's a practical side to this, which we don't too often talk about, and it's just, again, to say, so it's not a question of anti-industry or just high profit, low profit. It's actually a question of looking at the market, and there we are being, in my opinion, not smart enough from the policy maker side, or from the public side, from the public good side, vis-a-vis those who, which also includes my own members, have to earn a profit on the other side. And that's the balance we have to find.
Thank you, Casper. Ancela, you want to come in on this briefly?
Well, I want to support, I mean, Casper's, the comment he made about competition. Yes, boosting competition is key for affordability, and I think that will be one of the things that we at least are going to push for in the context of the revision of the pharma legislation. And about the question about the profits, I mean, for us it's about bringing some fairness. I mean, we're talking about, and I'm really talking about the, you know, originators like new, innovative medicine. Some of the prices are like exorbitant. The profits are huge. And it's about fairness. They don't have to be, I mean, making profit is legitimate, and no one is questioning that. The question is, how can you make so much profit in an area that is of high public interest? And again, we're talking about human rights, and then that creates. There's no logic in that. So it's not about, being against companies making profit, but it's about bringing balance, because that impacts affordability. I mean, profits come from somewhere, right? From the prices, and so for us, it's about fairness, really.
Mm-hmm. Thank you. Sarah, please tell us what people are asking online.
Thanks everyone for posting your questions. So there are 3 types of question. One relates to what Ancela just mentioned now, how can we, and what we discussed in general, how can we dissociate profits and human rights? How can we dissociate affordability and patents? Then the second question is about, shouldn't we talk about a global approach to medicine affordability rather than a European? And the last question is, we need to look at a different model of pharmaceutical development. Are there any pioneering approaches not following the business as usual? Any member states leading by example?
I'll start from the last one. And I would say, I would modify it a bit. Are any member states really taking the lead right now in driving these discussions, or the affordability agenda specifically, Rui, in your opinion? Do we see any champions in the Council? And Dorte, that'll come to you afterwards.
Member states of the European Union also, they have different perspectives, because their industries are different, of course. Some member states has a very strong pharmaceutical industry, and of course they intend to defend their own industry, and profits for those member states they are very good, even if they will be very high. Sorry about that. Because they pay taxes, they have good salaries, people will be spending, and they have good jobs. And they have very good jobs, as good as that there is some kind of brain drain within the European Union for countries like mine, that the young people, very well trained, are going to those markets. And so we are losing these guys. So it's not so, we are not in a unified, homogeneous perspective in interest on the member states. Also, we think about this the same way, and it is not. I think it will be a little bit difficult, and maybe the Valletta initiative, it's not, so well because of the forces among the member states. However, there are good initiatives. The innovative medicine initiative from the Commission is very good. I mean, you put money for developing new medicines to make them more affordable, and for those who most in need. And even in a perspective of human rights, which is a good thing. I agree. Also, I think that there was very good questions made on the global perspective. The question is that how much, let's move a little bit on this. How do the European Union, and with what we have learned during the COVID and can we make on the global perspective on looking at medicines? I remember the very high discussions had been in WHO on intellectual property and public health, and everybody knows that. The trading issues, and how did we deal with that, and putting money in some funds for not, trying to get the prices too much low on the global perspective, for not having problems within the industries that Western world have, because we are not producing other things at this point. So it's very much intellectual property. I would think that in this global health perspective, the European Union and member states have to go along, and I agree with that, on the global perspective, both ways. One, having a fairness of pricing, and also having a market that can help to develop innovation. Otherwise, you are not going to get it, and it's a problem. As well as having a solidarity. That's what distinguishes Europeans from other people, I would think. And we strongly have to defend this. How do we do this? Of course, there is a price to pay. There is a price to pay. And the question is that we as a society, do we agree with that? I'm sure that member states, they have a very strong pharmaceutical industry. They will agree with that because the return of the profit will be okay. They can afford that. Others, they have to be maybe help to make that happen. I don't know, really. We are discussing, aren't we?
Yes.
Yes, absolutely.
No solutions.
Dorte, is it our member states, is Europe ready to pay higher prices post-pandemic? What would you say to that?
Well, I think that certainly during the pandemic, we saw the importance of medical innovation. And it was, in fact, the fast development, but also the fast approval of the vaccines that really got us through the pandemic. So if we take that as our point of departure, then it is extremely important that we have a regulatory setup that can really help produce these types of saving graces. And of course, the vaccine that came first was developed in the US, but was with European input and from European research. And I think we should really take pride in that. Also, if we then apply the global perspective, and again, I agree with we really cannot just look at this in isolation in Europe, then Europe's purchasing power also meant something for global access to the vaccines. Through the very large purchase orders placed by the European Union, the companies were able to quickly scale up their production, and the European Union are now still receiving many vaccines that we don't need for our own populations that we donate through COVAX and other ways to make sure that there is global availability of vaccines for other countries. So using the European Union's purchasing power in times of crisis and using our long-term innovation ability to help produce these technologies are very important. And I do think that we are also willing to pay a premium to ensure that we have this innovation going forward. And there should be some solidarity at the European level to make sure that this exists, for sure. But at the same time, I will say that joint procurement agreements can be an important part of the mix in the future. They really show their value for the vaccines, but I would be hesitant to apply this across the board for all types of medication because it might not be the most efficient way to ensure competition in the markets. Mm-hmm. And as I've tried to say before, competition and transparency and fairness are really the key elements in making sure we keep prices low on medication in Europe, and we can improve transparency all across the European Union and achieve this.
Thank you, Dorte. And here the panelists are nodding in agreement with you. Do we have questions in the room? Is there anyone who wants to? Don't be shy. Yes, please introduce yourself.
Good morning, I'm Benedetta Baldini. I work for the European Social Insurance Platform with Yannis, representing statutory healthcare payers. So I have one comment on transparency and one question on competition and competitiveness. So on transparency, we discussed a lot with our members that are statutory healthcare payers about the value of transparency. And of course, we are in support of transparency both from the company side and from the regulatory side, which was reflected also in our recommendation towards the revision of the general pharmaceutical legislation. We reflected on the fact that the full scope of information being provided to pricing and reimbursement authorities when the time comes to evaluate a medicine may put an excessive burden, especially on small authorities. And then we discussed how to shift the focus rather to transparency of public-related, publicly funded R&D. So this is just a reflection that I wanted to bring to the discussion. And regarding competition and competitiveness, my question would be in light of, well, the recent decision of the Regulatory Scrutiny Board, which rejected the draft impact assessment toward the revision of the general pharmaceutical legislation. So just to provide a bit of context, the Regulatory Scrutiny Board is the audit body of the Commission. which evaluates each proposal before it comes to light. And apparently in the draft impact assessment, a huge focus is put on reducing data protection for every product as a way to incentivize competition for generics and biosimilars. And of course, this is the worst nightmare for traditional pharma companies. And my question would be whether you see the reduction of data protection as somehow impacting competition in a good way for generics and biosimilars, and in a bad way for profit-based companies. Thank you.
Thank you very much. Any other question? Yes, Richard.
Yanis, if you allow me a comment rather than a question, maybe, but could trigger some debate. So I'm Richard Bergström, currently Swedish government and part of the Commission negotiation team for the vaccines. So I very much appreciated the kind words by Dorte from Denmark about the successes of what we've done. And in fact, this was a buying club. And I hope that can inspire some conversation about how we can actually leverage the instruments we have, not for everything, but for some things. But just a perspective on this thing with profit. So when I started this job 2.5 years ago, we were told there are 141 vaccines in development. We're now using 2. There were totally 4 that made it in time. We're still waiting. One that's just started to deliver too late. One is coming soon. So actually 2 companies are making money. All the others have lost money. Hopefully not AstraZeneca. Janssen, we started using them a little bit. Okay, I hope they haven't lost any money. They had no aspiration to make a profit. But all these other people have lost money. 2 guys, 2 companies, yes, they make a lot of money. They have. But on average, I think it was a great success. So I think, I subscribe to the notion of fairness, right? But then you cannot pick out individual companies, individual products. We have to zoom out and look at the totality, Is this industry delivering? Are they coming with innovation or not? If they do not, okay, then we can start winding down the prices. But as long as we get new stuff coming, and we actually had this morning, I think, some promising data for once on Alzheimer, But we have to have a good discussion about how is that going to be procured for Europe at prices that are fair. So that's my comment, Janis.
Thank you very much. Thank you. I'm sure it triggers a lot of discussion. I'll come to, so we heard first point that when we get information, or if we get information on R&D costs, perhaps we will not be able to assess those those pieces of information, or that information can be manipulated in different ways. But then there was a question on the ideas that were leaked in this draft impact assessment, because we don't know, we cannot know right now officially what the Commission is considering in light of the General Pharma Revision. We only see and read things in the press. But I would like to hear from you, what do you think of this? Ancela, is it a good idea to play with the data protection periods, with the exclusivities? Shall we change those? Would those favor such a change, a reduction, a scale back? Would that favor competition? Would that harm the competitiveness of the sector?
I think in relation to data and market protection, our proposal was to have, so we don't think it makes sense to just give 10 years to all products, but to distinguish between products for unmet medical needs and products that are not for unmet medical needs, to channel a bit innovation where it's needed the most, because that's also important. But then my point was also to add safeguards, so you can maybe reduce these protection periods to avoid abuses. And for example, having something like we have in the orphan regulation, which unfortunately has not been disclosed, that would allow reducing the market exclusivity if the company is making already like too much profit and so on. So having a similar kind of mechanism to prevent abuses, that's a little bit at the model that we propose for data and market protection.
Rui, is it the holy grail that we cannot touch, the whole IP discussion? Is it something that we shouldn't even dare to discuss? What do you think?
I don't know. I think you did a very good point, Richard. And that makes things much more difficult. I don't know what we. That's a very, very good, very good point. You know, when we're looking at this sum up, we tend to people like me, in several aspects, a lay person on these subjects, on you know, the market and these kind of issues. We tend to look at the very specific companies or very specific issues, or it's very specific rare disease and that particular medicine or something like that. But when you look at the sum up, you will be losing and you have gains in some things and you'll be losing in some others. So maybe we have to, on a fairness perspective, maybe we have to look at in a more complex perspective, which would be looking at the sum up for each one of them and make things more difficult, much more difficult, but more fair, Because we need these people being in the market. We need them. It's not a question of not, and everybody wants to promote in their own countries those kind of companies. My country is very, I mean, we try to, you know, we have one maybe, and we'll try to have 10. And so for young generations to have good jobs, remember this. We want, and this is a very, very good thing, because it's not just a question of the beneficiaries are the patients. The beneficiaries are also the generations that are being prepared to work on these kind of issues. And they are very, very well prepared, and we have to give them opportunities. And to give them opportunities, money has to flow. There is no other way. And so it's a more global issue, even in a local perspective. Sorry, maybe I didn't answer it, but that was my reflection after Richard's comment.
Dorte, is tweaking the IP-related incentives, is it something that should be off the agenda, or all topics are on the agenda and should be explored? What is the Danish position?
Well, certainly my position is that we should have all topics explored. I think we're at an important moment in time for EU pharma legislation, and so we should definitely look at all options, but we should also look at the options thoroughly and explore adverse effects of different policy options that are on the table. So we should look at everything, but we should be very careful when we do something here. And I think that it's important to remember that if you reduce the protection periods for medication, then the companies who are innovator companies, they will have to recover their cost in a shorter period. So it could lead to, in fact, higher prices for these medications in the first years that they are available on the markets, even if it might lead to lower prices in the longer run. So we really have to be careful with that. I think there's a lot to be said for looking at whether we can further incentivize medications for unmet medical needs, including for antimicrobial resistance issues and new antibiotics. I think we have a huge problem there. There is not a rich enough pipeline, and there is not enough development going on. So we really, as an EU, have to look at how can we incentivize this and look at whether additional incentives are called for. There are several models being explored. I don't think we have a thorough analysis yet of which one should be the preferred one, but there's the exclusivity voucher mentioned, I think, in the impact assessment that we have seen, but there's also talks on a Netflix type subscription model, and perhaps other models. We are not zoomed in on which one is the most relevant one at the moment, but we certainly think it bears looking at this because we do need to incentivize this agenda hand in hand with having stronger stewardship on using less antibiotics in the EU as a whole.
Thank you, Dorte. Very, very clear, and I think perhaps this is the antibiotics development field, perhaps is the field where we can think a bit outside the box, also coming to the question that we had from our friends online about alternative business models. But I agree with you, I haven't seen anything very convincing, but there are a lot of options on the table that might be worth exploring. Casper, you have a comment on this, and Ansela wants the follow-up question.
Yeah, but actually just, I mean, for your question, around reduction, listen, if you have earlier generic entrants, yes, you will have more competition in the very long run. I think that's just a fact that we can't get around. Question is indeed, is that exactly what we want right now? Is that actually what we are seeking right now at this moment? That's not for me to answer. By the way, 70% of impact assessments are come back with a negative remark in the first instance. So I'm not too alarmed by that. You going back to, for example, transparency, where you say it's also about transparency on public R&D spending and so on and so forth. Yes, I think you came from a payer perspective, and I think a lot of payers, be that member states or be that health insurers, you know, there is a tendency for everyone to you know what you have, and you know the discounts you have negotiated, which are secret, you know. So you are protecting a little bit that you believe you got a good deal, and most people sort of want to believe they got a good deal. So I'm not surprised that full transparency is not necessarily 100% embraced by those who feel they made a good deal and who went out and sold publicly, I got a good deal. Reality is not everyone didn't get the best deal. That's a fact of life. That's just a fact of life. Not everyone got the best deal, and that's where I come to the practical side again of the market. You didn't all get the best deal. I know that for a fact because I know what you're paying, and I think that's. And when we come to fairness, I mean, I think Norway. You asked earlier who has gone quite far. I think Norway has been quite transparent and gone quite far in their wish to make a difference in this area. And when I started working with pharmaceuticals 4 or 5 years ago, I was a bit surprised to see that prices in Norway were so low. Norway was the largest parallel exporter per capita. It was high-priced medicines in other countries. They were exported to Denmark, Germany, and so on and so forth. And I said to the Danish authorities, just, you know, out of curiosity, why? And they said, well, the Norwegians accept to get their medicines much later. So typically the lag is 5 years. So, you know, I'm always a little bit cautious when it comes to words such as solidarity. I'm not anti-solidarity, but what does it mean? You know, let's please, and that's where I just argue again and again. Let's look at the practical side. Parallel imports saved 124 million euros for the Polish healthcare payers in 2018. Who would believe that? Poland, yeah? It's just to say the market, we tend to very quickly get up in these theoretical discussions and I don't know what, but it's not what we are seeing out there in real world. And I think that's where I would like to refocus sometimes, and I will continue to insist on refocusing a little bit on the practical side. And again, I mean, Richard, we can have long, very intellectual debates. I mean, when was the last time a top 20 pharma company had red numbers? There is no risk in that industry. So no, for the small ones, for the ecosystem, for those small companies, the biotechs out there who are actually doing all the real research and development, there's a lot of risk. Fully agree. But they are not necessarily the ones harvesting, you know, and I always take that perspective as someone who has studied economics and managerial economics. If you don't, in a sector, have the top 20 companies for a period of 30 years ever showing a red number, something may be able to be adjusted a little bit.
Thank you, Casper. I tend to agree, especially big pharma companies, I think are very risk averse. But we can continue this discussion. We have a full day, we have the dinner, we have drinks. Dorte, you are missing all of those. Ansela, you had a comment, please.
A comment, no, about the vaccines, because I mean, I think we forget that the public sector invested a lot to support the development and production of these vaccines. So we talk about companies taking risks, but we forget that the public sector also takes risks. And the public sector invests a lot also in early research and in early stages of R&D, but it's kind of, we forget about it, we don't see it. No, the public sector plays a role in that, so it's just a comment. And also when we look at when we talk about costs of R&Ds, the cost of failures are included. I mean, companies then even add the opportunity cost and many other things, but obviously the cost of failure, it's fair enough to include it in, you know, in the overall cost of R&D. I mean, I think nobody's questioning that, but it was just a comment about that I wanted to make about the vaccines, because the public sector does invest a lot also and supports a lot drug R&D, and we don't take it into account. It's like we erase it from the picture, and we think that the only ones that take risks are big companies, and I think, as Casper said, probably they are not the ones that take the most risk if we look at all the actors that play a role in drug R&D.
Development, yes, thank you. Sarah, do we have any other questions online? We do?
Yes, we
Please, go ahead.
Yes, so one question is today 47% of global new treatments are of US origin compared to 25% from Europe. It represents a complete reversal of just 25 years ago. Can the speakers comment on that? Then we have a question, do you believe there is a collective momentum from member states to make significant shifts in the policies affecting affordability? And then just a comment on the US market brings a lot of new medicines, but it has issues too. Examples of insulin prices and opioid crisis. So clearly the grass isn't greener in the US.
Thank you very much. Thank you, Sarah, and thank you to our friends online. Wonderful questions. So are we, Dorte, are we falling behind compared to other parts of the world, namely the US, when it comes to our innovative spirit in Europe?
I don't think we are falling behind in innovative spirit for sure, but maybe we can look at how we can tweak our regulatory framework to make it speedier to get access to funds for innovation, and looking at different risk-sharing arrangements as well. I think we can certainly do more to have more innovative output from the EU than we do today. And I think that's also part of the Commission's intention, but maybe these initiatives are not quite as fleshed out yet as some of the other initiatives they are thinking about. But we will continue the discussion with the Commission on this. And in terms of whether we can make a significant shift in affordability, well, I think we can. I mean, I tend to agree with Ernst that for sure there is more we can do to ensure affordability. And having a level playing field and transparency, using our purchasing power, we can do more to increase affordability as well. But we should be careful with the policy options that we use. And part of the problem sometimes, as Rui also said, is poor policies rather than, you can say, our regulatory framework.
Thank you. Ancella, do you think that the Commission has a clear direction of where it wants to go right now with this fundamental piece of legislation? Is there a clear vision?
I think there's a vision on where. So what's the goal, right? Like, if you think about, for example, the revision of the pharma legislation, incentivizing drug development in areas for unmet medical need, but also improving the availability, because the question of shortages in Europe is it's a problem, and affordability, because as I said, there's been increasing concern also from member states and many actors saying, well, we have a problem there. How to get there, I think that's what, in some instances, I think, I'm not sure there's much of a clear vision. And if you think about antibiotic development, for example, the fact that one of the measures being favored is this concept of transferable exclusivity vouchers. I mean, that for me shows that there's something a bit missing there, because I think the consequences of having such a tool actually on affordability for other products that will benefit, for which the exclusivity will be extended, I think that will create access barriers, delay entry of generics and biosimilars into the market. We're talking about also extending exclusivities, most likely medicines that will be like blockbusters, so huge costs for healthcare systems. So there are some policy incoherences there. And for me, the transferable exclusivity vouchers is a clear policy incoherence. So if finally the Commission ends up proposing that, I think we will have a big policy incoherence in the proposal.
Very clear. Thank you, Ancella. Casper, does the Commission know what it's doing, or is it lost in translation?
I think the Commission knows what they are doing. I think the Commission is sitting at the crux of all these discussions, and those discussions vary all the way from that very high level perspective of who's getting what, and on the other hand, solidarity, actual concrete lack of access in some countries. I really do believe they sit in a very difficult spot. I do believe that some of the discussion is a bit too stigmatized. There are things that we are not discussing, and I do believe, as I said from the very beginning, we are not always looking at this enough from the practical side, which partially comes from the intransparency we have today, that we actually don't know enough about the market and regulators. And that's not a criticism of the European Commission. But if I'm to be honest, I do believe there is actually some lack of knowledge to really be able to find potentially the right solutions, and too much stigma around certain topics in Europe. So Do they know what they're doing? In principle, yes, but do they have the tools and the means available to actually deliver for us at the moment? I'm not entirely sure.
Dorte, from your perspective, the member state perspective, are there, on the Commission's mind, are there too many voices? And can the Commission, in trying to strike the right balance that you and all the panelists you keep referring to, can the Commission make everyone happy or equally unhappy? What would you say?
Well, I think the Commission is doing a very good job in putting these issues on the agenda, and I think we should have an openness to discuss all available options. This is important both for human rights, for access to medicines, for our environment, for competitiveness of the European Union. So these are huge issues, and the Commission is right to table ideas for new regulation, and we would be very happy to enter into concrete, specific talks with the Commission on how to proceed. So far, we have only seen in the media this impact assessment, but we have started up debate with the Commission, and I think we will arrive at a good solution. In the EU, we never have solutions that make everybody happy. That's a nirvana I think we will never reach. But if we can reach a point where we're all just a little bit unhappy, but we also see some advantages, then it will be good enough.
That is very true. Thank you. Ladies and gentlemen, final chance for any questions. Yes, I see one, and then we'll come up and wrap up the session. Please introduce yourself.
Good morning, everybody. I'm Juan from the European Patients Forum based in Brussels. So throughout the discussion this morning, the topic of unmet medical needs have been mentioned several times, and how these may link to different periods of market exclusivity or perhaps incentives for novel medicines. However, my question to you is the following: what are medical unmet needs, or how we define those? I think that we could all agree that, for example, the need of new antibiotics is one of those, but what else? Thank you.
And we can wrap up with this very simple question, an easy question. So can we get to a point of having a European definition of unmet medical needs, Juan? That is the question, right? If I understood you correctly. Dorte, you go first. You can also wrap up with your concluding remarks.
Okay, thank you very much, Hannes. Well, we certainly don't have a definition yet. So if we are going to go down this path, then we have to develop one together, and it's important we get it right. I would be reluctant to endorse the idea of having a list of particular diseases that we have to treat with specific medications, because we might not know which medications in the end will be very useful for us in the future. Sometimes medications that are being developed or technologies that are being developed can have a use across different types of pharmaceutical interventions. They can be like a basis for different types of medication. And in order to incentivize this, it would be a mistake, I think, to zoom in very narrowly on very particular uses of the medication. That being said, I really think there is a case to be made for antibiotics, and we have to find a solution to that. We're very concerned that we don't have access to a good enough pipeline of new antibiotics. And at the same time, we're concerned that we're not active enough stewards in order to reduce the use of antibiotics. So here we really have to unfold all our efforts to think of new solutions. But unmet medical needs, it's necessary. And I think that we should have very broad stakeholder involvement in how to define this and make sure we hear all voices so that we don't get this wrong, because this could be very important in the future. And here I'm also thinking of some of the new therapies that are coming out, HMPs, etc., future interventions where you can cure chronic disease instead of treating it for a person's lifetime. We have to think about whether this could also be unmet medical needs in the future.
Thank you, Dorte. Rui, can we get to the point of having a definition of unmet medical needs?
There is no definition, but there are some tools that can help us to do that. One thing is horizon scanning could be a very important tool, and we need to use it more and more effectively even at the European Commission. But look at this, even if the European Commission has the definition and trying to get some consensus, there you're going to have you need to go to the Council and having member states to agree. And do you know how many years did it take a consensus for health technology assessment? A lot. So that's what we are prepared for.
Thank you, Rui. Ansela?
Yes, maybe more than a fixed definition, it could be some criteria, right? And I agree with horizon scanning can be also a very useful tool. But I mean, let's not forget that we have in the regulation already and the current regulation, schemes for early access, early approvals. And this is usually understood for, situations for unmet medical need, and by that, in general, so life-threatening, seriously debilitating, no satisfactory treatment or no treatment. I mean, how then you go and define? But I mean, it's already, I don't think it's impossible, because we are, in a way, making use of that, at the EMA for conditional approval, exceptions, etc. But I think we should have had more of a debate about the question of unmet medical needs, and that's something that I was really missing in all the consultation process, and especially also for the Commission, also to have, with consumer groups, patient groups, healthcare professionals, to have more of a conversation on this topic, which is I think very important, because it's important for drug, like in the context of drug development, and what do you prioritize there, in the context then of the approvals. Early approvals and access schemes, and then for the question about the incentives, right? So it is a very important topic, and I don't think we have discussed it much during the consultation process.
Thank you, Ancela. And Casper, over to you for final concluding remarks.
Yeah, I'm not competent to answer that question, to be honest, but I have other questions which are just down the same alley, like what's the definition of a high-priced novel medicine, now that we're discussing OMI yesterday, and we are discussing all kinds of model for high-priced novel medicines, but which are those? Is it 20,000 euros? Is it 100? So then let me just add another question to that, so thank you, Juan. And again, to a certain extent comes back to my whole point about all this. Let's get a bit practical. Let's have a definition of what are we talking about. I'm not saying this, it's fine if it's criteria, that's not my point here, but we discuss high-priced medicines, but we can't define what it is. And so when I'm being asked by the WHO, can we make some studies into this? I said, well, I can get you data, but once life gets real and data needs to be provided, I need a price. I need to know what products. I need a list, because otherwise we are just talking. So that would again just be my message. Let's get practical.
Yeah.
I believe that's how we deliver.
Thank you very much. I'm sure that in a year's time we will meet again. Dorte, I look forward to welcoming you to the Valley. And I'm sure that this discussion will continue, especially in light of the upcoming European elections. I'm thinking a bit further ahead, but next year's time we will be closer to the European elections, and we will be thinking of the issues that the next European Commission should prioritize and not park. Dorte Beth Wizard from Denmark, thank you very much for joining us. Casper Ernest for hosting us. Rui Portugal, thank you for coming to Gastein. And of course, Ancela Santos from BEUC. Thank you very much for joining us this morning, ladies and gentlemen. Enjoy the rest of your day. Thank you.
Thank you, Yanis.